Welcome to any students, medical practitioners, health professionals, community health workers, service providers, researchers, policymakers, safety workers, and more who are curious about how to enhance community and population health. This video provides specific examples for how public health and occupational therapy are a natural fit. This matters because of the major population and community health issues that are challenging us today. For instance, recovery from the pandemic, including challenges in homelessness, high rates of incarceration, major stressors such as employment challenges, fear of safety in schools, and financial insecurities due to uncertainty in the economy. Hi, my name is Dr. Lisa Yeagers. I'm a professor, researcher, and promoter of health and well-being. I'll be giving an overview of each of these professions and providing specific examples for how they each complement one another and contribute to a more rich and robust effort towards community and population health. So, what do I mean by this type of health? To quote the U.S. Department of Health and Human Services in 2018, the vision of Healthy People 2030 is the realization of, quote, a society in which all people achieve their full potential for health and well-being across the lifespan. The 5 main goals of the Healthy People 2030 initiative include the following. 1, attain healthy, thriving lives and well-being, free of preventable disease, disability, injury, and premature death. 2, eliminate health disparities, achieve health equity, and attain health literacy to improve the health and well-being of all. 3, create social, physical, and economic environments that promote attaining full potential for health and well-being for all. 4, promote healthy development, healthy behaviors, and well-being across all life stages. And 5, engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all. So, you might be asking, why am I able to speak on these topics? It turns out that I've been an occupational therapy practitioner for over 20 years and combined this with public health research over 10 years ago by completing my PhD in the field of behavioral science and health education, both focus areas within public health. I talk more about this journey, so feel free to visit my channel to check out more. I value your time and have provided timestamps in this video so that you can skip forward to any content that is most useful to you. Also, my show notes include links that reference all of the quotes and content mentioned in this video. In 2018, I presented on the topic of public health and occupational therapy at the AOTA, or American Occupational Therapy Association conference, and it was with occupational therapy professor colleagues of mine, Dr. Heather Williamson and Dr. Mirtha Whaley. And Dr. Julie Bass also contributed to the presentation. After presenting our views on occupational therapy and public health to this audience, we found that attendees were in the not confident and somewhat confident range at the start of the session, and by the end of this 2-hour short course, their confidence level increased, leaving them confident and feeling very confident by the end. So I'm hopeful that in these topics that I'm presenting with you today, your ability to describe them as a result will also have increased. So I'm going to dig into a couple of simple definitions of public health and occupational therapy. What is the relationship between the world of public health and OT, you might be asking? To some, this may be an obscure topic, where public health explained by the American Public Health Association, or APHA, is described as services actively promoting policies, systems, and services that enable good health and seek to remove obstacles and systemic and structural barriers, such as poverty, racism, gender discrimination, and other forms of oppression that have resulted in health inequalities. So the APHA reports, quote, everyone should have a fair and just opportunity to achieve good health and well-being. To explore the occupational therapy profession and how it compares, OT service providers also seek to promote health and well-being. And according to the AOTA, at the core of occupational therapy practice is occupation, those things that are activities people of all ages need and want to do, Things like making meals, dressing, managing medications, driving, going to school or work, playing, or caring for family members. Occupational therapy is defined in the AOTA's practice framework as the, quote, therapeutic use of everyday life occupations with groups, persons, or populations, i.e. the client, for the purpose of enhancing or enabling participation. In the world of OT, occupations are a means to health promotion and well-being. And by doing, we can maximize health. And OTs seek to understand and focus interventions to include the issues and concerns surrounding the complex dynamics among the client, caregiver, family, and community. Let's look at each of these professions more closely. According to the APHA, quote, everyone should have a fair and just opportunity to achieve good health and well-being. They represent 10 essential public health services to protect and promote the health of all people in communities, including 1. Assess and monitor population health. 2. Investigate, diagnose, and address health hazards and root causes. 3. Communicate effectively to inform and educate. 4. Strengthen, support, and mobilize communities and partnerships. 5. Create, champion, and implement policies, plans, and laws. On to 6. They seek to utilize legal and regulatory actions. 7. Enable equitable access. 8. Build a diverse and skilled workforce. 9. Improve and innovate through evaluation, research, and quality improvement. And last, 10. Build and maintain a strong organizational and infrastructure for public health. For instance, those in public health might focus more at the community and population level to promote the use of seatbelts, to reduce injury or death due to car crashes. Or they may advocate for clean water to prevent widespread disease from people drinking it, or to use safety equipment that may reduce risk of injury in work environments. Examples of the many fields in public health include first responders, restaurant inspectors, health educators, scientists and researchers, nutritionists, community planners, epidemiologists, occupational health and safety professionals, public policymakers, and public health physicians and public health nurses. And I stress those two to show the example of how someone in a particular field, such as medicine or nursing, may add the title of public health to their job description or title to show that they have a special emphasis in the area of public health. As a comparison, occupational therapy is grounded in the concept of occupational justice, in which all people have the right to participate in the activities for which they want, need, and have to do to support their health. Practitioners work with individuals in groups and communities, and sometimes populations, to identify what challenges are they experiencing to reduce or prevent their ability to do the things that they need, want, and have to do in daily life. So from a public health lens, who are occupational therapists? They are health educators. They prevent disease and injury. They prevent secondary conditions that result from disease and injury. They facilitate access in disability, promote the optimal ways to function in daily life. Occupational therapies enable access. They also promote well-being of those with chronic illnesses. They reduce healthcare disparities. They enhance factors that impact quality of life. And they promote healthy living practices, social participation, and overall occupational justice. Here's a few examples of occupational therapy practitioners doing public health related services. For instance, injury prevention and ergonomics programs in manufacturing plants. Aging adult driver safety programs such as CarFit that is sponsored by the AOTA and AAA, or American Automobile Association. Sedentary work activity promotion is another area that OTs can reduce risks for chronic health issues. Psychoeducation for management of mental illness include prevention of suicide, a very prominent public health issue that is ongoing in our society. Occupational therapists also seek transition and integration or reentry programs for people incarcerated in jail or prison settings. And The list goes on and on. So occupational therapists provide community-based practice in many settings, and we have endless examples of OT in action using community-engaged needs assessment and participatory intervention development that I'll talk about in another video. I also just scanned the American Journal of Occupational Therapy's July 2020 issue that highlights peer-reviewed research presentations from their national conference held in, I believe it was San Antonio this past March. And so I scanned the journal to find a few topics of interest that showcase how OT is utilizing a public health lens in their innovative research. One title is Understanding and Addressing the Impact of the COVID-19 Pandemic on Latinx Families and Children with Developmental Disabilities by Brown and Hawley and authors. Here's one with OT and Public Health in the title, OT and Public Health, Educating Head Start on Early Identification of Delays by Barlow and authors. Another title is Implications of Occupation-Based Trauma-Informed Care for Gun Violence Survivors, a Mixed Methodology Study by Sheth and authors. Here's another one, Outcomes of OT-Led Coaching to Support the Success of Students with Disabilities in Higher Education by Zalotniski and authors. My apologies for mispronouncing your last name. And Planting Seeds for Hope, a community gardening intervention for adults with mental illness in transitional housing by Soros and authors. The last example is called Hybrid Interventions to Promote Health-Related Outcomes in Adolescents with Autism Spectrum Disorders by Lamash and authors. As you can see, there's a rich list of new research showing very community engaged and active programming that are being evaluated by OT practitioners, researchers, and faculty in the field. Therefore, we are both seeking, public health professionals and occupational therapy practitioners, we're all seeking to promote health. We're just doing it in slightly different ways. However, our activities can certainly complement one another and support each other. For instance, occupational therapists find ways to adapt and modify activities so that the person can do the things that they need, want, and have to do. Consider the way that public and community spaces are designed and how it may limit participation when things are less accessible to a variety of people. There's a wonderful example of collaborative approaches in action from the organization called Kulture City. And when I say culture, it's spelled with a K, and they, quote, create sensory accessibility and inclusion for those with invisible disabilities. And in my opinion, I feel they're utilizing public health principles, among others, with occupational therapy to increase access. Kulture City reports that 1 in 6 people experience a sensory-related disability due to post-traumatic stress disorder, autism, dementia, stroke, or other conditions. Kulture City has utilized occupational therapy to design and implement sensory education programs that are utilized by venue planners, designers, and facilities such as theaters, aquariums, libraries, sports stadiums, zoos, convention centers, places of faith, parks, and more. The need for sensory accessibility is great and a major public health challenge, while the skill to address the specific sensory processing needs of individuals and how it impacts their families and the broader community is invaluable to informing inclusive practices. And OTs with specialization in sensory processing are critical members for public health promotion and this team. I have in my show notes a link to Kulture City and the occupational therapist who is on their team. In 2020, the American Journal of Occupational Therapy published a position paper on the role of occupational therapy in public health. This was really important because we've talked a lot about how OT and public health fit so nicely together, and it was great to see a recent position paper by our national organization that tied these things together. It states that OT practitioners have three critical areas or roles in health promotion and prevention that underpin these programs and interventions. The first one is to promote healthy occupations and lifestyles for everyone, including people with various ability levels and those who are marginalized and at increased risk for health conditions. The second is to incorporate occupation as an essential element of health promotion strategies. And the third, to provide occupation-based interventions not only with individuals, but also with families, communities, and populations. As you saw in that Culture City example, the two professions very nicely complement each other and are both necessary for a holistic approach. So if you're in public health and working on a health promotion program where people of all abilities are targeted and specific interventions are needed to educate people, help them to adapt, modify environments or the context in which they live, work, or play, then seek out occupational therapy practitioners to inform your planning, program design, and specific interventions for groups and communities of people. Similarly, for those occupational therapists out there seeking to promote health and designing interventions, look for those public health practitioners who can also complement your work. This multidisciplinary or interprofessional approach, along with community engagement and listening to people with lived experience, sounds like I need another show on that topic, will add depth and a wealth of perspective needed to innovate your ideas and ensure they work within a variety of contexts. We can learn so much from each other, and I encourage partnerships and the rich collaboration that may result. Well, I want to thank you so much for joining me today and appreciate your thumbs up and subscription to this channel. I'll have future videos on related topics in public health and occupational therapy and more. My name is Dr. Lisa Yeagers, professor, researcher, and promoter of health and well-being. I hope you have a great day and seek ways to be well.